One Billings student is dealing with more than just the pandemic right now. She is currently living with type 1 diabetes, a disease she was diagnosed with a decade ago. Well, Q2's Shaquille Cozart talked with her about how she's coping and trying to make a difference.
Madison Martinez is a 19-year-old sophomore at Montana State University-Billings, majoring in psychology. She said her life passion is to advocate for chronically ill kids and teach them to embrace their diagnosis and not let it hold them back. This passion comes 10 years after she herself received news that she had been diagnosed with type 1 diabetes.
My sister and I were kind of playing around on the stairs like anyone would do. We were just kind of roughhousing a little bit, and I actually ended up falling down 3 steps. And I hit right here in my back, and it just really hurt.
Martinez said that her back pain lasted abnormally long, so her and her family decided to go to the pediatric clinic. And after explaining her situation to the doctor and further investigation, the doctor decided to test her for type 1 diabetes. And when the test came back positive, Martinez's life took a drastic change.
A lot of times I have to prioritize getting a good night rest. I can't just cram for a final and be I'm staying up and then I'm going to take the test. That's not going to work for me because my blood sugars are going to be all over the place. So I need to plan on that aspect. And then from there, even just normal day life, I obviously can't eat or drink or do anything without taking insulin or testing my blood sugar.
The recommendation for a patient with type 1 diabetes is to check the blood sugar using a finger poke 6 to 10 times per day. Also, they should inject insulin every time they eat, which is generally meals and then also at bedtime. So if you think about how you eat through the day, most people eat 3 meals and then a couple of snacks. So that can be upwards of 6 to 10 shots as well.
Martinez says that even though type 1 diabetes has changed her life, she won't let the disease hold her back.
I try to stay positive as much as possible, but there's times where that's just not doable, and I'd be the first one to admit if you're gonna fight anything, you better give it your all. You better have bad days where you cry and you don't want to get out of bed, because if not, it's just gonna really hold you back.
Reporting in Billings, I'm Shaquille Cozart with MTN News.
Thanks, Shaq. And Dr. Woods says, especially during these times, we have to be cognizant of those with underlying health conditions, no matter the age.